Welcome to the brand new episode of Meet the Masters. I am Bindu Sridhar, your host of the day. Today, we have with us Dr. L Shyam, who is the medical director of Dr. Shyam's Ayurveda Center. He has 20 years of Ayurveda experience spanned across 19 countries. He has successfully implemented 66 Ayurveda and wellness projects. Welcome, doctor. Welcome to the show.
Thank you.
Well, doctor, can you please share a few details with our viewers about what is Ayurveda and what are the specialities of Ayurveda?
See, Ayurveda is a science which is evolved over 5,000 years of time. So I can proudly say it is a science which is tested and evolved over 5,000 years of time. Right? It's one of the toughest tests any science can face. Right? And it's the best way to evolve also, right? Through trials and errors, through the experience of the doctors. The word meaning is Ayu means life and Veda means science. So the literal meaning of the word Ayurveda is science of life. So you cannot compare Ayurveda with allopathy or you cannot compare Ayurveda with homeopathy. Rather, when it is the science of life, you need to compare Ayurveda with a science like biology, right? Means bios means science and logos means knowledge. So the nearest equivalent for Ayurveda, it is biology, right? Ayurveda is not just about treating some diseases. Rather, it's a science of life, it's a philosophy of life. It teaches how to live in sync and how to live in harmony with the nature. If Ayurveda was a religion, I believe nature would have been its goddess. Right? So as far as human universe is considered, Ayurveda has two objectives. Number one is to prevent the health problems in a healthy person or to maintain the health in a healthy person. And secondly, to cure the disease in a diseased person. So in the curative aspects, Ayurveda has different specialities like the modern medicine has, like the general medicine, ENT and ophthalmology, surgery, pediatrics, toxicology, geriatrics, and the health concerns of reproductive tissues. So it has 8 branches on the curative aspects. On the preventive aspects, Ayurveda teaches, how to live in sync with the nature, like daily regimens, seasonal routines, dietetics, and these are, a comprehensive, details about Ayurveda.
There are 3 bodily elements called Vata, Pitta and Kapha. Can you please explain what is the concept behind these all?
See, the terminology is, Vata, Pitta and Kapha. It may be easier for an Indian or for a Keralite, But still, you might find it, like alien languages, Vata, Pitta, Kapha. So they are just names, right? Instead, you may call it like XYZ also, no worries, right? Vata, Pitta, Kapha, they are basically names given to a set of qualities and a set of functions. Vata is a name given to a set of qualities like when there is dryness, movement, lightness, cold, all these qualities coming together, you call it Vata. Vata is the energy factor which governs all kind of movements. Say for example, I speak because of Vata, you nod your head because of Vata, you blink your eyes because of Vata, lungs breathe, heart pump, muscles move, conduction of nervous impulses. You name any movement in the body, it is governed by Vata and because of its qualities. Pitta is the energy factor which governs all kinds of transformations like food digesting inside the mouth by the salivary enzymes, food digesting inside the stomach by the gastric secretions, or a sound signal right now getting converted to a nerve signal. So let it be an enzymatic change or a neurological change or a biological change or a chemical change. You name any kind of transformations, it's governed by the energy factor Pitta.
Okay.
Kapha is the energy factor which governs growth, lubrication, immune functions at the core level. These are some of the basic functions of Kapha. So we all have Vata, Pitta, Kapha in the body which do the entire functions or the physiology of the human body. For example, you look at the process of eating food. Chewing, it's a movement which is done by vata. Digestion by the saliva inside the mouth is a pitta function. Lubrication of the food is a kapha function. Swallowing is vata. Movement of the stomach is vata. Digestion by the gastric enzymes inside the stomach is
right?
correct. So they work together. So when they are working together in balance, in harmony, you say, all your functions are good, right? But the moment, when they get imbalanced, your physiology will be upset, and which you term it like pathology or the disease process. But the moment, you realize Vata Pitta Kapha in its true sense, in terms of its qualities and functions, you will be able to see Vata Pitta Kapha in everything. For example, you look at the sleep pattern. The first phase of the sleep is mostly a Kapha time. The middle part of the sleep is a Pitta time. The last part of the sleep is a Vata time. So in the Vata time, you can see, the rapid eye movements. And it's the time, when you see dreams or light sleep, right? And as one of my teachers say, even you take cricket, right? You take a test match, you say it's a Kapha style of batting, right?
Yeah.
You take a one-day cricket, it's more of a Pitta kind of batting. And when it's a 2020, you don't know where to hit, right? It's more of a Vata kind of batting. So it's basically a beautiful concept, which is given to a set of qualities and set of functions. And Ayurveda is, the base is so strong that it's able to explain each and every disease and health in terms of this Vata Pitta Kapha.
Okay, that's great. And what are the Ayurvedic routines for healthy life, and what are the dietary guidelines for health?
It's a long topic. Yeah. The question was, how to live healthy, yes, how to live free of disease, right? Ayurveda says, Nityam Hidahara Vihara Sevi. That means, one who follows a wholesome diet and a wholesome routine. Wholesome, that meaning I have to explain. What is good for the goose may not be good for the gander, right? So what is good for Bindu may not be good for Shyam, right? So we need to identify, what is the best food for Bindu, or what's the best food for Shyam, and what is the most suitable daily routines and seasonal routines for a person, and follow that.
It depends on the health condition of a person, or
No, it depends on the body type of a person also. Health conditions as well, right? Not only just the body conditions or the constitution. It's about climate. It's about, the geography you live in, right? And the movement of the sun, the position of the moon, it's about everything. Ayurveda also gives, a lot of emphasis on the emotional and spiritual perspective to live healthy. It says, one, who is conscious about their acts, and one who is conscious about their words, and who is generous, who is truthful, who is always surrounded by sattvic people, and forgiving nature. These are all, very essential things which are required to live healthy. So it may not be so easy to follow all these parameters to live healthy. But on a physical plane, I can say there are three pillars of life, which is called aharam, that is food, sleep, and healthy sexual relations, right? Ayurveda says these three are considered as three very important pillars of life.
Can you please explain Ayurveda practice in UAE, that is recognition as a traditional, complementary and alternative medicine?
Ayurveda is recognized under the traditional, complementary and alternative division under the Ministry of Health, which was recognized since 2012. So several medical systems, were recognized, together with, like the homeopathy, Chinese medicine, Unani medication, all these were recognized together. Say, for example, if you look at the Indian perspective, we have a Ministry of Ayush in India. Ayush represent Ayurveda, Yoga, Unani, Siddha and homeopathy.
Combined version.
Correct.
Yeah.
Out of this Ayush systems, other than the Siddha medicine, all the Ayush systems are recognized in UAE since 2012. In UAE, there are not less than 400 Ayush practitioners. Ayurveda, Unani, homeopathy practitioners are there. There are not less than 100 plus clinics in UAE. Right? So the system, it's still young. It's only 17 years now from the day it is approved as a medical system. So it is evolving every day, and the patient mix, it goes very much in tally with the population mix of UAE from my experience. So like 50% of our patients, they are Indians or from the Indian subcontinent, right? And the rest 50% is a mix of nationalities, Europeans, that goes very well in sync with the population mix of the country. So it's getting well accepted.
How the geographical and the climatic aspects of UAE favoring to Ayurveda?
See, what works in India may not work outside India, right? Because the land is different, the flora is different, the fauna is different. If you look at India, you have two ayanas or two solstices. The sun rises sometimes in the southeast for 6 months, and the other 6 months, it rises in the northeast, right? Because it is India is near to the equator, so it has both solstices. But for a country like UAE, which is on the 23-degree latitude, sun mostly rises either in the east or in the southeast. It doesn't go much to the north side. Right? So we have only two seasons therefore, right? The summer and the winter time. Right? But still, when you look at the core principles of Ayurveda, the Vata Pitta Kapha, one will be able to evolve a model for a country which is in the 23-degree latitude. So we have, few months which are dry and hot. We have few months which is humid and hot, and few months, which are cold and dry. So Ayurveda for global acceptance should evolve a model, for each geographical locations. Not only the geography, the health problems are also different, and the expectations from the healthcare recipients, that's also different, right? Because it's a developed country and recently developed country, right? So the expectations are much different for a country like India, which is a developing nation.
Doctor, what are Pathya and Abhatya, or do's and don'ts in Ayurveda?
It's a common question, most of the people have, For example, I had a patient, yesterday who came with a skin problem. I suggested some medicines, for the patient, and later I said, avoid yogurt, avoid sour and salty taste, reduce urud dal, reduce dosha, idli and all. Okay. The patient was, so upset at me. Doctor, why so many restrictions, right? So I told him, restrictions are inherent to nature. For example, the fact that you need to breathe to live now is a restriction, right? So there are several restrictions, which are imposed by the nature. And that's on a philosophical plane, when it's coming to the reality. Pathya means do's, Apathya means don'ts, right? So when somebody is asking what is the pathya for this, my problem, I will say, the things which has to be favored, which you have to eat more or, indulge in more. Apathya means don'ts. There is a misunderstanding about, the concept of pathya, apathya in Ayurveda. Most of the people, they think that, I take a kashayam, I have to stop eating non-vegetarian and fish items. There is nothing like that. The pathya and apathya are mostly specific to the health condition. They are not very much specific to the medicine which they are taking. There are very few medicines, which has pathya apathya specific to the aushadha, pathya apathya specific to the medicine. For example, if you are taking sulfur, gandhakam, salt has to be restricted in the food when you are consuming gandhakam. But when you are taking gandhakam for a condition like skin disease, you have to favor milk. But milk is contraindicated in a skin condition, right? So, for example, a skin condition usually increases by the over intake of sour and salty taste. On the other side, we are treating the condition with more bitter and astringent food items or bitter and astringent medication. So, while you are taking a bitter and astringent medication, you equally eat, sour and salty, the medicine will not be as effective. So, it's a waste of, your time, the patient's time, the physician's time, and it's a waste of resources also. So, that is why, the Vaidyas, the doctors, they suggest to follow certain pathya, apathya while you are having a specific health issue and while you are having a certain medication.
It's especially for these Ayurveda kind of medicines, right? In allopathy, it's not there, no?
Why not? See, even if in allopathy, for example, you are a diabetic patient, right? The doctor suggested you medicine. And along with that, they will tell you, you reduce carbohydrate, you do regular exercise every day, right?
That is a kind of this
So,
thing.
it's also
yeah,
a pathya apathya,
yeah,
right?
Sure.
So, pathya apathya is everywhere. That's why I said, restrictions are inherent to nature.
Doctor, how oil therapies and Panchakarma helps in Ayurveda?
When you think about Ayurveda, the first image which comes to your mind is that dhara flowing on your head, right? Again, Ayurveda is not just about oil therapies. Ayurveda is, much more than oil therapies, which I mentioned to you previously. It has different specialities from general medicine to surgery. And oil therapies are only a minor part of, the entire Ayurvedic concept. To some extent, it's sad that, only that oil therapy, the fancy part of Ayurveda is getting popular, right? See, oil therapy are used for treating several health issues, especially musculoskeletal problems. For example, for a problem like low back pain, right? Something equivalent or better than physiotherapy. We have so many therapies which are evolved in Ayurveda or which are evolved in Kerala.
That is known as Dhara, oil therapy in a...
No, the oil therapies, it can be used in multiple ways. For example, you might have heard about treatments like kiri, right? Kiri, you prepare herbal bundles and dip this in hot oil and massage with these in a special manner. Dhara, you can see, oil being continuously poured on the head. In Pirichul, you can see the oil being poured on the body, right? Now, each therapy has its own specific properties. And again, the products can be different for Shirodhara. For example, we can use a specific oil for Shirodhara for a problem with headache, a different oil for insomnia, a different oil for hair falling, a different oil for skin disease. So, according to the selection of the oils, a treatment like Shirodhara can have multiple benefits, right? So, a massage therapy or an oil therapy in Ayurveda, it should not be something a retail item in a supermarket. It should be prescribed by a doctor by assessing the health condition of the individual, and the right oil and the right therapy for the right person, that's more important. When you asked about Panchakarma, Pancha means 5, Karma means treatment. So, it is 5 treatments which are mentioned in Ayurveda, which is, one is called the Virejanam, that is a purgation therapy, an emesis therapy, enema therapies, nasya, that is a nasal drop, and bloodletting in certain cases.
What is this nasya means?
Nasya is the application of some herbal medication into the nostrils for several diseases. It can be used for sinus congestions, it can be used for headaches, it can be used for neurological conditions.
For migraines also we can use.
For
this
migraines we
instrument.
can use it.
Okay.
Again, by changing the type of the product, right? So, oil therapy is not Panchakarma. Panchakarma, they are, these 5 treatments, which are, Ayurveda call it like to eliminate the imbalanced dosha out of the body. The oil therapies or the fermentation therapies, they are called Purvakarmas, they are the treatments which prepare the human for the Panchakarma therapies. So, don't be confused that Pirichil Shirodhara is Panchakarma. And Pirichil Shirodhara or an oil therapy in Ayurveda should not be a wellness treatment. It should be therapeutically prescribed and taken.
What is this wellness treatment really mean?
See, a common trend in Malayalis, they come to an
Nowadays
Ayurvedic...
this term is commonly hearing this term like wellness programs are going on, wellness
I get, several inquiries, to my clinic daily basis asking, do you have Urichil, right? Do you have Ayurvedic massage, right? So, we say, we are a clinic, right? Please walk in, consult with our doctor. The doctor will guide you, whether you are eligible for an oil massage even. There are several people, who are not eligible for an oil therapy.
Okay.
So, one who is having, a rhinitis, a cold, runny nostril, sneezing, he is not eligible for an oil massage, right? So, it has to be, selected very carefully, the right oil. Again, when you look at the oil, for example, there are different types of oils you can think of, in a common practice. Say coconut oil, which is cold in potency. Almond oil, cold in potency. Mustard oil, hot in potency. Sesame oil, hot in potency. Olive oil, hot in potency. Castor oil, hot in potency. I know some people, who mix all these oils and say that, it's very good for my hair fall problem. Right? No. See, some people like warm weather, some people like cold weather. Right? So, every individual is a unique manifestation. So, coconut oil might suit you, but it might not suit for me. So, that's why I said, the selection of oils are also very important.
Can you please explain the scope of Ayurveda in UAE?
See, I would always say the scope of Ayurveda, not only in UAE, in the world, it is eternal, right? Because if you look at the population of UAE, aged population is increasing day by day, across the entire globe. Not only people are living longer, people are living longer with chronic diseases. So, for example, a condition like osteoarthritis of the knees, spondylosis changes in the neck and or in the low back.
That is a common issue nowadays. I heard this neck issues. For me also having the same issue, neck problem.
See, that's why I said, not only people are living longer, people are living longer with chronic diseases. So, the increased prevalence of chronic diseases is a challenge for all the healthcare delivery systems. And I believe Ayurveda can contribute a lot in the management of chronic diseases. And not only the chronic diseases, non-communicable chronic diseases, for example, diabetes, hypertension, obesity, autoimmune conditions, all these conditions, the prevalence is on the rise. So, again, Ayurveda has a lot of scope in that area. And the other scope which I foresee is the uniqueness of Ayurveda, which treat the individual according to their uniqueness. As I mentioned, what is good for you might not be good for me. So, Ayurveda treat not only the disease, Ayurveda treat the person who carries that disease. So, having, its own innate strength, Ayurveda has a lot of scope in the healthcare delivery system in this era.
Please share about Dr. Shyam's Ayurveda Center, its future plans, its specialities, and everything.
We started Dr. Shyam's Ayurvedic Center in the year 2011, so 8 years now. Currently, we have 7 clinics across UAE. We are spread across Dubai, Ajman, and Ras Al Khaimah. All the centers are daycare centers where we have a licensed, MOH licensed or DHA licensed Ayurvedic doctor, and all our therapists are licensed by the Ministry of Health, right? And all our clinics, since it is recognized by the ministry, we get insurance coverage for most of the treatments, including, when it is prescribed by the doctor. Because we don't practice Ayurveda as a massage therapy. We practice Ayurveda as a curative treatment. So currently, I don't believe in a chain of clinics. Rather, I would say, we have group of individuals, right? My clinic in Karama, it has, its own uniqueness compared to my clinic in Jumeirah, right? So we offer, different kinds of services across our clinics. We have doctor consultation. We have the doctor's advice for the lifestyle modifications. We offer the Ayurvedic therapies. We give the medications or guide them where to source these herbs from. So these are the services which we offer. See, we are driven by a philosophy that get the patient better, right? So be committed, to the patient care, that is our philosophy.
What has been your most satisfying moment in your professional life?
See, for a physician, every day is satisfying day, right? Yeah. The moment, a patient, come and tell you that, doctor, I'm feeling better, right? Even if they say, doctor, I'm feeling, 10% better, still, it gives a lot of satisfaction, a lot of contentment, for a physician. See, and I always believe, my best achievements or, if you're talking about that, they are still ahead of me. I came in the year 2000 and Ayurveda got recognized in the country in the year 2002. And I was lucky to be the first licensed doctor approved by the Ministry of Health. So in 2017 and in 2018, I was awarded as the best physician by the Dubai Health Authority. And in 2018, I was awarded as the leaders of healthcare. So from a time, where I was not allowed to put a doctor title in front of me, and in 15 years, I could be awarded as the best physician, I feel satisfying.
So thank you for your valuable time spending with the Medivis team. Any message to our viewers?
Half an hour, we were talking, right? Yeah. 1 hour or 30 hours is not enough to talk about Ayurveda. And even I won't be satisfied by spreading the message of Ayurveda. It was wonderful speaking with you, and Medibis has always been very supportive to promote the true essence of Ayurveda. Truly appreciate it. Thank you very much.
Thank you, doctor. Thank you for your time.